What's going on, guys? Medicine in 3 minutes, back here with another video, and today we're going to be talking about SIADH. We're going to get straight to the point, keep the subject clear, brief, and illustrated, so let's get started. Now, SIADH does stand for Syndrome of Inappropriate Antidiuretic Hormones. Now, when we're dealing with SIADH, it's actually going to occur in the posterior pituitary gland. So originally what happens is that the ADH, or the antidiuretic hormone, it's produced in the hypothalamus, but it's actually stored and released by this posterior gland. Now, what is happening with SIADH is that there is an increase release of this hormone, the ADH hormone. So, from a definition standpoint, it's going to be characterized by excessive release of ADH, right? Either from the posterior pituitary gland or any abnormal non-pituitary source. Now, unsuppressed ADH causes an unrelenting increase in solute-free water being returned by the tubules of the kidney to the venous circulation. Now, what is essentially going on is that the ADH is actually responsible, to send a message to the kidneys and tell it, hey, there's too much water, you need to stop, right? So basically what happens is that since there's an increase of this hormone getting released, the kidneys are constantly more than they need to getting told, hey, retain water, keep retaining and keep holding. Now, what this is going to cause is water retention. You're also going to find high urine osmolarity, and you're generally going to find it in old smokers, and it's going to also cause low sodium in the blood. Now, the reason why you're going to find it more in old smokers is generally because of small cell carcinoma, which is lung cancer. You are going to find that most of the people that have small cell carcinoma are going to be, smokers. And essentially what this cancer does is it tells, whatever region that is affected to produce ADH. And since it is already getting produced by the pituitary gland and it is produced by that, there's an excess. Now, another thing that we're going to find is that the body is going to go through something called Euvolemic Hyponatremia. Now, what does this mean? So this is a normal body. As you can see here, it has normal liquid levels and it has a normal amount of sodium. Now, what we're going to find here is that we're going to find an euvolemic. Now, so that means it's the exact same level of liquid, but there's a hyponatremia. So that means there is much less sodium in the concentration. Now here, there's an example of a hypervolemic hyponatremia. So as you can see, the liquid levels are much higher, but yet the sodium levels are much lower. And again here, you're going to see a hypovolemic hyponatremia. So that's going to be less liquid and also less sodium. Now here, as we can see, what happens in SIADH is that there's going to be the same level of liquid as a normal body, but there's going to be much less concentration of sodium. Now, just a brief outlook of what we just went over. So you're going to find it in old smokers, and that is due to small cell carcinoma that comes from smoking. Again, it's a lung cancer where the ADH levels are produced in that region of the lung, and that's going to cause an excess that is released. You're going to find one ectopic production of the ADH. You're also going to find that there is a water retention. There's going to be a low blood sodium level. There's a high urine osmolarity, and we're going to talk about the treatment, but it's generally a fluid restriction plus 3% saline if the sodium levels are greater than 112. Now, just to go into more depth about the treatment, just use this visual. So you're going to want a fluid restriction, so you want absolutely no liquids going in to the patient. You want nothing going in because there's already an excess. We're trying to get it out, so you want to have a complete restriction of fluids. If plus or minus 3% of saline, if the sodium levels are greater than 112. So they have to be greater than 112, then there's 3% of, give or take, of saline that is prescribed. So thank you guys for watching another episode of Medicine in 3 minutes. Make sure to hit that like button, subscribe if you're new. Make sure to leave a comments down below, turn on that post notifications. We're dropping videos every couple of days now. We're really pushing them, and we have a website dropping soon, so make sure to stay tuned. We got lots of content, and let us know your feedback, what you think of the videos, and thank you guys so much. Have a good day.